Thank you so much. So to begin, I just want to share a little bit of a difficult story. On May 24th of this year, just a few months ago, an 8-year-old boy died in Palmdale, California. Gabriel Fernandez was the victim of multiple severe injuries caused by child abuse, which was perpetrated by his mother and her boyfriend. At the center of this story is the Child Protective Services Agency, who was actually called to the house 6 times over the past several years, but was never able to substantiate a case of child abuse and never was able to remove the child, Gabriel, for his own safety. This is a tragedy. And in light of all of this, the leadership at the Child Protective Services Agency made in a public statement a comment saying that in this case, the system failed the child. And this is inexcusable. So we have to ask ourselves, what went wrong here? And what could we do differently? Child Protective Services are our systems at the state level, the city level, county level that address incidences of child abuse and neglect and maltreatment. It is a complex and entrenched environment made up of multiple stakeholders, including the juvenile justice system, mental health departments, family courts, including numerous provider networks. And each of them has a different mandate for documenting, storing, and sharing data. And this happens across multiple unconnected platforms. So when you think about this kind of complexity, it might be easy to understand how a case could slip through the cracks. But when you think about the consequences, what happened to Gabriel, it becomes clear that change is imperative. Traditionally, what we do to evaluate child welfare is to look at outputs, not outcomes. And when I talk about change being imperative, I'm talking about rethinking our strategies to address this issue. And I want to focus really, really briefly on, the what, but more importantly, I want to talk about the how. So what are we doing in terms of rethinking child welfare? First is to focus on prevention. There's a real economic case to be made about focusing on children in the early years and addressing risk before it becomes abuse. And that is, if you invest $1 in a child from birth to age 3, you get a $12 return over that child's lifetime. And that's money saved in the foster care system, juvenile justice, public assistance, the prison system. And if you think about what that child can do with a high school diploma, with a college degree, when she becomes a productive member of the community, the case becomes really clear. And in terms of the how, I want to make a case for evolving our model of evaluation. Because like I mentioned, we usually look at outputs. What's the number of children flowing into and out of the system? How many kids are flagged for referral or re-referred to the system? In doing this kind of work, what we don't determine are the outcomes. Are our families actually getting better? Are they improving along markers of well-being? And so this is why we developed the Family Assessment Form. This tool looks at family well-being across a number of established markers. And so caseworkers can implement the tool in the beginning of services and the end to demonstrate exactly where and by how much a family's improved in functioning. So we look at things like living condition, the financial conditions, what supports are available to caregivers, social supports or access to health care, how do caregivers interact with each other, details about their personal history. And through this process, we can get very, very detailed feedback on how our programs are functioning. And the impact of this is very, very real. Like in the case of Medisol, who was a participant in the Partnership for Families program, or PFF. PFF is a county-wide strategy in Los Angeles that targets at-risk, first-time, or young mothers. Medisol was referred to services when she delivered her second child in 2 years at the hospital. She had received inadequate prenatal care. She had expressed feelings of frustration. She couldn't make ends meet, wasn't sure how she could pay her bills if she was taking care of the new baby, was so overwhelmed. She even had thoughts, and she said this to the nurse, of just dropping it all, running away, and effectively abandoning her children. In the Partnership for Families program, she was able to work with a caseworker, and using the family assessment form, we were able to document her strengths and her needs. And what happened was we learned that she herself was a victim of abuse as a child, and this had gone untreated. She was currently in an unsupportive relationship. She had no idea what resources were available to her in her community, and she had no one to turn to talk to for support. So what we were able to do was get her set up with counseling, introduce her to a parenting support group, which she participates in regularly, and help her kind of further her goals with parenting and to really engage with her children, because the outcome could have been 2 small children in the foster care system, but now with really detailed feedback and really focused service planning, we're able to ensure that our children stay with her and grow up in a healthy environment. This same model of feedback can be applied not just to the family, but to entire communities and to entire program areas. So the Partnership for Programs family, what they were able to demonstrate is that 80% of people who participated in their program showed meaningful change in this area of caregiver and child interactions. So what does that mean? That means the program's working. It means that families are becoming stronger. It means that parents are using and eliminating parents are eliminating use of physical discipline. They're providing a structured environment for their children. They're engaging in more effective communication skills, and they're taking ownership in this role of being a parent. This is real change. And this goes so much farther than just knowing the numbers. This is how we determine the ecosystem of family success, and we focus on funding what works. So moving forward, my goal is to continually refine the tool and taking the FAF to the next level through feedback and providing better answers for programs and the folks that work in those programs. In doing so, we can ensure that we stay ahead of the curve and provide better outcomes for our families. Eventually, my vision is to build something of a family-facing portal so that folks can log in and see data from all the services that they receive in kind of one clean area, so they can take ownership of their own service plan. So my ask to you is really simple. We're in a position to grow, and as such, I'm looking for as much input as possible. I would love to meet you, learn about your respective cities, how your families work, what you're seeing, what your needs are. And as we can engage in a thought partnership, I think the real benefit is clear. We can ensure healthier children, stronger families, and safer communities. So thank you very much.